Dr. Vern Dryden with Veterinary. I've used AniCell for the last 2 or 3 years and been very happy with the product. I will use it on situations where I've got a torn ligament or tendon, or effusion or synovitis in a joint. One of the best uses that I've been able to see is for tendon and ligament injuries. If I've got a severely torn ligament or tendon, I'll typically sterilely prep the area, shockwave it, and then inject with the AniCell right after I shockwave it. I feel like the shockwaving is going to help activate those cells, turn on the receptors to heal, and then once we implant the AniCell, the amnion, into the area, we get a better healing effect. So typically that's my protocol for any tendon or ligament strain or injury, significant injury. I've had great luck placing it in horses that have gone on to compete at 5-star Grand Prix jumper level, Grand Prix dressage. The highest level of reining athletes I've used it on. So for me, it's one of my go-tos for tendon ligament repair.
David Priest here at Keeneland Racecourse, Lexington, Kentucky. I have recently been using amnion-based products in a couple of injuries in my practice. Most recently, a superficial wound over a sesamoid bone in a thoroughbred racehorse, a chronic wound that we were having trouble healing with traditional treatments. The amnion-based sheet that we were able to apply over the wound had a really good result, full resolution of the wound in a couple of weeks. That horse is back training now. Very pleased with the results of that. Prior to that, I used an injectable amnion-based product in a lateral suspensory branch lesion. We saw full resolution ultrasonographically of that lesion in 45 days. That horse is back training and breezing. Very pleased with the results of that. I find the amnion-based products particularly useful because of the ability to carry them in my truck, use them at the time of diagnosis, so very practical, very easy to use. The safety that I've experienced with the amnion-based products is excellent, no adverse events, and I've had similar experiences shared with me by other veterinarians that I work with. So overall, I'm very pleased with the use of amnion-based products in my practice.